Hello and welcome. My name is Dr. Eric Bailey, and the title of my paper presentation is Applying Anthropology as an Antidote to Solve Gen Z Preventive Behavioral Patterns and Mental Health Status Associated with COVID-19. During the past 4 years, the United States and the entire world experienced an ongoing global event, the COVID-19 pandemic. COVID-19 disease originates from the severe acute respiratory syndrome coronavirus 2, SARS-CoV-2. By 2021, more than 70 million infections and 1.6 million deaths have been reported in over 190 countries and territories. The disease is characterized by various symptoms appearing during a range of 2 to 14 days after exposure. The virus seems to spread through droplet transmission with symptoms ranging from very mild to very severe, while certain people infected may not experience any symptoms at all. The most common symptoms include fever, cough, congestion, and fatigue. One of the fundamental problems in combating the spread of the SARS-CoV-2 virus and thus the COVID-19 disease is that pre-symptomatic and asymptomatic people are infectious. At the beginning of the COVID-19 pandemic, government, public health, and medical officials in the US and countries around the world recommended that all individuals implement the following preventive measures to reduce the spread of SARS-CoV-2 virus. 1. Lockdowns. 2. Limitations of one's activities with the public. 3. Social distancing. 4. Mask wearing. And 5. Vaccination. Although each preventive measure was met with varying speculation and resistance from many segments of the populations, those who followed the suggested preventive measures tended to significantly reduce their chances in getting COVID-19. Nonetheless, there were specific segments in the US population that differed significantly in adhering to the recommended preventive measures in reducing the spread of SARS-CoV-2 virus. In particular, stark disparities have been uncovered between the young and older generations in terms of their willingness to wear facial masks and engagement in other preventive behaviors. For example, while 53% of people age 60 and above self-reported to have engaged in all of the 6 Center for Disease Control and Prevention's recommended mitigation behaviors, including face covering, hygiene, social distancing, and avoiding crowded places, only about 38% of young adults aged 18 to 29 years practice all these methods. Therefore, what were the major factors for the cause of this distinct disparity of adhering or not adhering to preventive behaviors associated with COVID-19 between the young and older generations? Here's my research study. To find answers to this disparity, I conducted a random sample of 500 Gen Z college students attending East Carolina University here in North Carolina, ranging from first-year freshmen to graduate school level. East Carolina University, with over 28,000 students, is the third largest constituent institution of the University of North Carolina system. It offers bachelorette, master's, specialist, and doctoral degrees in the liberal arts, sciences, and professional fields, including medicine and nursing. The campus is located in Greenville, North Carolina, a city of more than 87,000 people and the hub of business, healthcare, and education in the eastern region of the state. It is within a 75-minute drive of Raleigh, the state capital, and close to Atlantic coast beaches. With the assistance of the Center for Survey Research at ECU, our Qualtrics online quantitative and qualitative survey was distributed to 500 ECU Generation Z college students from November 1st, 2021 to January 31st, 2022, with a response rate of 10%. That's 51 fully completed surveys. The Qualtrics online survey consisted of 45 structured and open-ended questions investigating 4 health and behavioral issues. 1. General health, nutrition, and exercise. 2. Vaccinations and COVID-19. 3. Mental and physical health status. And 4. Social demographics. In February 2022, I received the entire data set from the Center for Survey Research and began data analysis using SPSS 28.1 software, Navivo 12 qualitative software, and Atlas TIA qualitative software. Here's my quantitative findings. The major findings from our survey of Gen Z college students at East Carolina University concerning their symptoms, health beliefs, preventive behavioral patterns, and mental health issues associated with COVID-19 were as follows. 1. 85% of our sample were vaccinated against COVID-19. 2. 67% of our sample were worried about the spread of COVID-19 on campus. 3. The major factors which influence students in getting vaccinated were personal, 78%, family and friends, 71%, prevention, 63%, and school, 59%. 4. More women, 50%, than men, 33%, felt that moral values influenced their decision to get vaccinated against COVID-19. And 5. The major factors which did not influence students to get vaccinated were mandate, 24%, race and ethnicity, 4%, religious, 2%, and government recommendations, 2%. Interestingly, as we dug deeper into these general frequency statistics with our applied anthropology, qualitative software and analysis, we discovered that there were a number of serious mental health situations that students were experiencing as they dealt with the worry of the spread of COVID-19 on campus and for those who were diagnosed with COVID-19. Here's my qualitative findings. In particular, it was the open-ended questions in the vaccination and COVID-19 section of our Qualtrics survey, which uncovered the mental health struggle that many students experienced when they were diagnosed with COVID-19 and had to isolate themselves for several days away from all other students. The open-ended questions asked students, quote, here it is. For those who have been diagnosed with COVID-19, how did it make you feel physically, mentally, emotionally, or all of the above? Here were a few qualitative responses. Qualitative responses. Quote, it made me feel mentally and physically drained. For my mental health, it caused a lot of stress due to the negative stigma surrounding having it. It caused me to feel anxious regarding being around people I knew. Physically, I did not feel in peril, though I did feel terrible for a few days. It then declined into being a moderate sickness, unquote. Here's another qualitative response. Quote, physically, I was not seriously affected, which I contribute to having been vaccinated earlier this year. Mentally and emotionally, I was impacted by the required isolation period and consequently inability to participate in classes and social activities, unquote. Here's the final qualitative response. Quote, physically, my COVID symptoms were not much worse than a sinus infection, migraine, stuffy ears, etc. Emotionally, it was extremely hard to be locked up in one small room for 10 days, especially with schoolwork piling up. It made me feel depressive and I did not cope well, unquote. Using the qualitative software Navivo 12 and Atlas TI 8 to conduct the qualitative analysis, the major qualitative themes can be summarized as follows. 1. Students felt physically fatigued. 2. Students experienced mental and emotional strain due to isolation and stigma of being diagnosed with COVID-19. 3. Students became further scared of COVID-19 due to the continual online and news media reports. And 4, students, family members, and friends tended to experience more severe symptoms related to COVID-19. In summary, these qualitative themes help to highlight the biopsychosocial cultural impact of COVID-19 on the physical and mental well-being of Gen Z college students, as well as its effects on their family members and friends. Without this additional data and the applied anthropological qualitative analysis of such data, we would not have known the severity and true mental health impact that COVID-19 had among our Gen Z college students at East Carolina University. Now, here's my reflective comments. It is my hope that this research study not only brings practical public health and medical attention to this overlooked segment of our U.S. population, Gen Zers, and how they had to adapt to COVID-19 pandemic outbreak, but also increases the urgency that more research funding, research investigation, and public health policies need to be directed to this rapidly growing segment of our U.S. populations concerning all of their health issues, particularly their mental health issues, simply because they will be the next generational cohort to lead our country. My name is Dr. Eric Bailey, and the title of my paper is Applying Anthropology as an Antidote to Solve Gen Z Preventive Behavioral Patterns and Mental Health Status Associated with COVID-19. Thank you very much. Have a great conference.